Everybody can become a scientist on this. You can do a scientific assessment of how single payer would be liked by the American people. Ask an old person if they like their Medicare.
Right.
Yeah, but that's because...
Just ask them if they like their Medicare, and ask them what they think about an idea to actually make it private insurance instead.
Wait. Even a teabagger.
No, but wait.
Teabaggers love their Medicare.
The question. Yeah, don't ask old people, because old people cover about a third of the cost through premiums of what Medicare costs. Medicare is a system where literally everybody who pays into it gets more out of it eventually than they put in. It is the definition of unsustainable. Medicare is not a model for anything other than totally blowing the budget.
What would be awesome is if everybody was covered under Medicare, then you could do some real cost controls in it, and then you could get
like
costs under control, and then it would work better like Canada's does.
But again, I mean...
Again, it's been tried. We don't have to invent it.
I know, it does work there.
Unlike Bush's programs,
very well there.
Unlike Bush's programs, Obamacare is actually paid for. I mean, this is part of what is different about this president, is that he bit into the Cadillac plans. Medicare Advantage, okay? There are advisory boards for keeping controls down.
But the expansion of Medicaid is just a huge number for this. It's 18 or 19 million people who are covered under Medicaid. That's a huge blowout of the medical cost budget.
But again...
We don't blink an eye at the money that we have been spending on perpetual warfare. We literally don't even, we don't sit here and go, whoa, trillions and trillions of dollars for warfare.
We do over here.
But when we're talking about health care, which is our people and their well-being, we're shocked that it should cost us some money.
Here's a question, and this might be something that we agree on.
One of the major arguments in my lifetime is the argument that we have over health and how we take care of ourselves. It's gone on and on and on. The reason we're at where we're at is because way before I was born, the decision was made that because we're a capitalist country, that health should be seen as a profit-making institution. That's the way people saw it. That's why it's so odd that we're actually having an argument over something that was decided long, long ago, and there's still people who defend that. Now, I'm not sure that health is a profit institution. I'm not sure. Because it's what stands between you and fucking dropping dead! It's not soybeans, is it? It's not fucking fucking bottled water. It's not goddamn cell phone coverage, Time Warner shit. It's none of that. It's your health. And I know it's not a commodity because you've never stopped at a red light and had a crack addict come up to you and go, hey, can I sell you some of my health?